And on behalf of both the Quizmaster, Dr. MuraliMohan and myself, I thank the organizers for this opportunity. Yesterday we had the preliminary rounds. The participation was more than expected. We ran short of question papers and we chose 5 teams from the preliminary rounds. There was a tie in the 5th position. We conducted another additional tiebreaker round yesterday and selected the 5th team. I will announce the team. Please come one by one, pick up the lot here and occupy your chair. The chairs are from this A, B, C, D, E like that. So once you pick up the lot, please occupy your respective chairs. The first team from the team with the highest marks in the preliminary round, Dr. Tarun and Dr. Jeet from KMC Mangalore. Please come onto the stage. Please. Another person? Where is the other person? Okay. Pick up. D is there. 4th one. Yeah. The second team with the highest marks was Dr. Anil Kumar and Dr. Manoranjan from KMC RI Hubli. Please come onto the stage quickly. In the third team, Dr. Yatish KP and Dr. Ramesh, again from KMC RI Hubli. Please come. Second team, Anil Kumar. Okay. C, occupy the third chair. Yatish. Okay. E, last 5th. And the 5th team is Dr. Soumya and Dr. Shrikanth from RIMS Raichur. Where are the parts? Please. One more. 4th team is Dr. Akshay Hegde and Dr. Aditya from BMC Bangalore. No, wait a minute. Yeah. 4th team, Dr. Akshay and Dr. Aditya from BMC Bangalore. B, the second one. So please come onto the stage. Occupy. You are the 5th one. Chair A. Can you see all there? The screen is visible clearly? Okay.
Right, congratulations to all the teams who didn't make it to the final also. You all did extremely well. It was not an easy prelim, so congratulations to all of you. And keep trying. If you don't get it this time, you'll get it the next time. Congratulations to all the teams who made it here. A large part of the result is going to be luck. Okay, so we've tried to minimize the luck by doing, the way we do it, the rules we frame. But at the end of the day, somebody's got to win, somebody's not going to win. The whole purpose is to enjoy yourselves, learn something while you're enjoying themselves, and give some entertainment to our audience. 2 or 3 important things. Audience, do not prompt. You can destroy a quiz by guessing too soon. I know all of you are enthusiastic, all of you are knowledgeable, but please try and desist from the temptation to shout out the answer when you know it. There are a few audience questions, and if all the teams do not answer, then we'll throw it open to the audience. We have certain rules. First of all, let me thank Dr. Shrikanth Hegde. He's the person really who's done most of this quiz. And when I was asked to do the quiz, I knew that I would do it well only if I had his partnership with this. So the rules, first of all, we have, as you can see, 5 teams. There are 6 rounds. What we follow is the pattern of infinite bounds, and midway we reverse the order. Infinite bounds is when, say, the first question is asked to the first team, but only the third team gives the right answer. the next question goes to the next team. Okay, so that will be the pattern of infinite bounds. For direct questions, the team that gets the question first has only 20 seconds to answer. Okay, we have a very limited time, so we have to finish. We'd like to get through the whole quiz if possible before Dr. Raghavendra throws us off the stage and says, your time is up. Okay? So subsequent to that, all other teams must answer immediately. We're not going to wait. A correct answer, whether it's direct or past, will get 10 points. There are no negative points for wrong answers in the special rounds, except in the special rounds. Special rounds will carry negative. We'll tell you about those when we come to it. Okay? So this we've spoken about. The first round we'll go A to E, and the second half we'll reverse the order and go from E to A. Yeah, the sixth round is a rapid fire round. We'll announce it when it comes to that. The correct answer there too gets 10 and a wrong answer gets -5. Okay, we hope we don't have a tiebreaker, but in case of a tiebreaker, we will come back. We'll revisit this. Very, very important part. To get points, full answers are needed. The quizmasters will decide whether a question, the answer deserves fraction points or not. That will be solely at the discretion of the quizmaster. Traditional quizzes mean if you give part of the answer, but they give the complete answer, they get the points. Okay? So if you don't know the full answer, don't give it. You may be helping some of the others. But remember, if they don't get the answer, none of the other teams, we may avoid fractional points. Okay? So it's part of the quiz technology that you have to follow. And the most important is the decision of the quizmaster is final on all matters, whether it's to the answer, points, time. We say that we are always right, even when we are wrong. Okay, so the quizmaster is the final word on everything. Right, of course, attractive cash prizes. We know that that's traditional. First runner-up and second runner-up will also get. And I think Dr. Shrikanth Hegde is very clear about this. You have to sign a disclaimer that whatever you do, we will proceed only when you accept these terms and conditions. Any doubts? None at all. So let's proceed. Yeah. So these are specifically a good disclaimer. All images, investigation reports, ECG, X-rays of Dr. Shrikanth. Some of mine are my own images, some are not, but they are from his real-life cases and collections. So sometimes the quality of the images may not be ideal, but we will have to accept those because it's good to get real-life questions. Okay. And again, all the pictures that you see in between are Dr. Shrikanth Hegde's. As you can see, he's a brilliant photographer. Okay, round one, question one to Team A. Team A, before we start, I'd like you all to introduce yourselves and the institution you come from.
Myself, Dr. Soumya Hiregaudar. I come from Raichur Institute of Medical Sciences, Raichur, second year postgraduate.
Thank you.
My name is Dr. K. Sushant. I came from RIMS Raichur.
I'm Aditya Yu from BMCRI, second year postgraduate.
I'm Dr. Akshay S. Hegde. I'm from Bangalore Medical College, second year postgraduate.
I'm Manoranjan, third year postgraduate, KMCRI Hubli.
I am Anil Kumar Auti, third year postgraduate from KMCRI Hubli.
My name is Dr. Tarun Gupta. I'm from KMC Mangalore.
My name is Dr. Jeet Dedia. I'm from KMC Mangalore.
Myself, Dr. Yatish KP. I'm from KMCRI, third year medicine PG.
Myself, Ramesh, KMCRI, third year PG. Thanks.
So we have two teams from local, KMC Hubli, one from KMC Mangalore, one from Bangalore Medical College. You all have big shoes to fill because I think all the recent quizzes have been won by BMCRI, so pressure on you before we start. And of course, RIMS, the city of our chairperson and the incoming chairperson. So let's start without any further ado. Team A. One word links all these images. Can you let me know? And Dr. Shrikanth will keep the time for this bit. It's called that. Time? No answer. We're moving to team 2.
negative marking is there.
No negative marks. This round there's no negative mark.
Lupus.
Lupus is the absolute right answer. Would you like to explain those images?
This is lupus pernio, seen in sarcoidosis. This is immunofluorescence suggestive of SLE. Then that is malar rash SLE.
Okay, the top is difficult to identify. I'll give you the full points. That's lupus vulgaris, lupus pernio, and the lupus erythematosus rash. Okay, full points to team B, Bangalore Medical College, 10 points. So the next question then will go on to the next team, team C. Team C, what investigation will show this kind of result? This is called the 9-panel result. No guesses? Team D? KMC? No answer? Kim's?
Platelet function test restores.
Sorry?
Platelet function test restores in assay. Platelet function test.
Platelet function test. No, not quite. I think you're thinking of thromboelastography. No, that's not it. Team A, RIMS. Quickly, please. No? BMC? No guesses? Audience? This is a tough one, but it spans cardiology, pulmonology. This is a cardiopulmonary exercise test, or CPET. That's how the results are displayed. If you look carefully, you can see things like VO2, VO2 max, and so on. My apologies if it's too tough, but that's cardiopulmonary exercise testing. Next question goes to the next team. That's team E. No, sorry, team D. Team D, your question. What condition is this linked with? No negative, you feel to guess.
PNH,
PNH, no, not paroxysmal nocturnal hypotension.
Sir, breast cancer. Breast cancer.
Breast cancer, good answer, but not right. Team A. Team A, no guesses. BMC, Team B, no guesses. Team C, no guesses at all. Audience, no rheumatologists here. So this is called the purple butterfly tool, and it's used in SLE, and it's very interesting because it tells you in a single image the age of the patient, the gender based on the tilt of the butterfly, the organ damage represented by each dot on the antennae, and the quality of life based on the short form 36. So this is in one picture, you get a good comprehensive image of the patient with SLE. And SLE, the purple butterfly has always been used for SLE because of the butterfly rash that you see on the patient, which is usually purplish in color. Okay, next question to Team E. Team E, with which condition or conditions is this animal associated?
Niemann-Pick disease.
Niemann-Pick disease. Team A. No guesses. Moving on to Team B. Team B. No guesses. Team C. No guesses. Team D. No guesses. I'm going to give 5 points to Team E because it is a rare condition. Niemann-Pick is included in these. So this is the thing for all rare diseases. So, you know, in medicine, we usually teach you when you hear hoofbeats, think of horses, not zebras. So the Rare Diseases Society says also think of zebras because that's why rare diseases get missed. So this is for all rare diseases. And in HIV, we say think of horses and zebras. Okay, so this is from the Ehlers-Danlos Society, Niemann-Pick Society, all rare diseases it refers to. So 5 points to Team E. And the next question goes to Team A. Team A, which skin prick test is replacing the Mantoux test? It's already in India, you can still get it in our cities.
Agra.
Sorry?
Agra.
I'm not hearing the right answer. Team B? No guesses? Team C?
IGRA, sir. Interferon gamma releaser, sir.
IGRA? No, not the IGRA test. No. Team D? No. Team E?
Pathergy test.
Not the pathergy. Pathergy is usually used for other conditions like Behcet syndrome. Anybody in the audience? You must forgive me, this is my area of pulmonology, but the CYTB test is meant to replace the Mantoux. It's far more accurate, and it's the next generation test. It's already available in India and is being strongly recommended. The great advantage, because of our BCG program, is the Mantoux gets vitiated by earlier BCG. This uses antigens which are not present in BCG strain or in non-tuberculous mycobacteria. So it's far more specific than the Mantoux. That brings us to the end of round one. And this is an audience question. Audience, preferably postgraduates first. If the postgraduates don't answer, we'll come to the faculty. This is a cardiac rhythm in a patient with an acute exacerbation of COPD. Yes, gentlemen, there. Can you come to a mic, please? Okay, Matt, he says multifocal atrial tachycardia. That's right. Do we have any prizes for audience? Okay. So excellent answer. Thank you. That's multifocal atrial tachycardia. 3 different morphologies, at least, of the P wave, varying size, varying amplitude, that is, and varying timings. That defines multifocal atrial tachycardia. Okay, round 2, starting with, the last question came to you all, right? Round 2, should we start again with A? No. Okay. We'll continue the universal bound. So, starts with Team B. Team B, all are pictures from the same patient. What is your diagnosis?
Sarcoidosis.
Sarcoidosis, 10 points for that answer, excellent. So you have erythema nodosum and you have the bilateral hilar adenopathy, very typical of sarcoid. So 10 points to Team B. Next question to Team C. Team C, what incident in medical history are these images associated with?
Cholera, sir.
Excellent, cholera. This is the famous John Snow identifying which which pump on Broad Street was associated with an outbreak of cholera. He removed the handle and people stopped using it and the cholera epidemic, local epidemic died down. So excellent answer, 10 points to Team C, KMC Hubli. Next question to Team D. Team D, what is the most likely diagnosis here?
Osteomalacia showing a loser zone.
Osteomalacia loser zones, excellent, 10 points there. You all can see the loser zones very clearly in the shaft of the femur in a patient with probable osteomalacia, but remember there are other conditions that can cause this also. Next question to Team E. Team E, this is a very typical echocardiographic finding. What's the diagnosis?
Asymmetrical septal hypertrophy.
Sorry?
Asymmetrical septal hypertrophy.
HOCM.
Not HOCM. Team A.
Myxomatous degeneration of mitral valve.
What of the mitral valve?
Thicken.
Loud, into the mic.
Thickening of mitral valve.
So what is the condition?
Mitral valve prolapse.
Not a mitral valve prolapse. Team B, quick answer please.
Mitral stenosis.
Mitral stenosis, as simple as that. You're seeing thickening of the valve, you said that. There's doming of the mitral valve, very, very typical of mitral stenosis. So 10 points to team B, BMC. And I think the last question on this round again goes to team C. Team C, what does this graph illustrate? You can see FiO2 on the x-axis, and on the y-axis the PaO2, and you have three different things saying 50, 30, 20, 10, 4.
Coaximetry, sir. Coaximetry.
Sorry?
Coaximetry, sir. Coaximetry.
Coaximetry. Very specific. I want to know what is blanked out there actually. Let me clarify that and you can still answer.
Hemoglobin.
Not hearing the right. I'm just looking for a single word.
Sir, ARDS Gold's criteria. ARDS Gold's criteria, PaO2 by FiO2.
No. Team E. No. Team A.
Ventilator perfusion scan.
Ventilation perfusion scan. No, not at all. Team B.
Methemoglobinemia.
No. Okay, this is a really tough one. My apologies again. But basically, this is showing us, I think we're going to skip the audience. Basically, it's telling us that as you increase the fraction of inspired oxygen, you can increase it in a shunt. But after a certain point, a 50% shunt will not be able to improve the oxygen at all, no matter how much oxygen you give. At 10% shunt or a 20% shunt, whichever it is, you can still improve the oxygen, but you need more and more oxygen. So basically, a shunt cannot improve with oxygen after a certain point, which is why the shunt fraction becomes important. Right, and the audience, one more question to the audience. Audience, look at this carefully. It's not very clear. What is the diagnosis? Again, PGs, please. So you can see this is a skin prick test, but you're seeing a lot of them are positive, and you're seeing the negative control is positive. Yeah. Or participants can also answer. Please feel free. Yeah, no marks.
Skin allergy.
Yeah.
Skin allergy test. Lethargy.
Skin?
Allergic test.
No, this is not allergy. This is what I'm... Okay. Right, nobody answers. This is dermographism, where just the act of pricking it causes a wheal. That is why the negative control is also showing, a response, a big wheal. So this is dermographism. You cannot interpret it as an allergy test. Okay, scores at this point, and then we go into a special round. Yeah, please go ahead and announce.
B, the score is 30. The team C scores 10. Team D scores 10. And team E scores 5.
Okay, but it's early days yet. All of you can win points, and the next round carries quite a lot of points. And then Dr. Shrikanth, who is very generous, will give you a lot of points in the second half, especially in the rapid fire round. Okay, so this is what is called a stage 2. Each team gets one question, and all the questions are linked by a common theme. So we'll start with the same order. If you get a correct answer, it is 10 points. But if it's a wrong answer, it's -5. If you don't guess, no points are deducted. You can guess the theme at any stage. If you guess the theme at the first clue, you get 50 points. If you get it on the second clue, you'll get 40. After the third, 30, and so on. Okay? So, and again here, I will give part points if anybody is... Yeah, so team A, this is yours. Identify what's here.
Clue 2.
Yeah, thought we. Yeah.
Clue 2.
Sorry? No, it's not. They said Kuru, right? No, it's not. Clue. This is the clue. Oh, sorry. Okay, for the benefit of all, I will call your attention to something there and a magnified version of that there. Okay, we really need to move. You're not giving us an answer. B, Team C, Team D, Team E. Nobody's guessing. Okay? Audience, anyone? Nobody loses points in the audience, so please feel free to guess. Sorry? Okay, we'll come to you, sir. So keep that in mind when you're guessing it. This is the second clue. Team B. Okay, let me do this another way, because this is, I think everybody's hesitating to guess. Can I have 5 sheets of paper, please? Plain paper. Okay, I'm going to show you all 5 clues. You'll guess the answers and write them down. And at any stage, you can put your hands up and tell me the theme. Use these. I hope you all have pens with you. You have a pen? Okay, so write down the answer to the first. Don't worry about negatives. We will be flexible and say no negative points. Write down the answers. The more right answers you get, the more likely you are to get the clue. But at any stage, you can tell me the theme. Okay, but the theme will carry negatives. Okay, so that's answer 1. This is clue 2. Okay, this is clue 3 coming up. To make it easier, I'll tell you this is a sample of sputum. No, we'll do it at the end of 5, so it's easier. Okay, so we go on to clue 4. Clue 4 says scanning speech, staccato-like articulation where words are broken up with pauses between syllables, intention tremor, incontinence, and internuclear ophthalmoplegia, nystagmus, also known as sin. Write it down. All answers, please write down. You'll get points for it. All of you will get points if all of you have given the right answer. Okay, and this is clue 5 coming up. Sorry, did you want to guess the theme on the last one? No. Okay, so, and you all can write the theme, and you all will get 20 points if you all get the theme. Also, in addition to all the answers you've got right. Everybody finished? Want to hand in your sheets? I'll start at that end. Theme, what links these 5? There is one thing that links all 5. Okay, let's move. Done? No theme. Okay. Exam time over. Thanks. Thank you. You all wrote your team name, no? Write your team name, please. Or just write teams, team E, that's enough. Saku. That's okay, don't worry about all that. Thank you. Thank you. Sir, can I request you to correct it while I announce? Right, so going back to this is a Charcot-Bouchard aneurysm. okay, which is a small aneurysm in the brain. This one actually shows you a magnified version. This is Charcot-Marie tooth disease, is the inverse champagne bait or inverted champagne bottle appearance. You can see tapering down in the lower half, the distal half of the leg. Those are Charcot-laden crystals that you get in asthma. This is the Charcot's triad of multiple sclerosis, scanning speech, intention tremor, etc., and nystagmus. And finally, these are Charcot's joints that you see. So the link is Charcot, very famous neurologist, considered the father of neurology. And I love this picture because it has so many of the other names you'll see in neurology, like Marie, Charcot-Marie tooth, Babinski, whose reflex you use every day when you examine a patient, and many others there. You know, Bournville's disease, Paranoid syndrome, Tourette syndrome. So this is a brilliant picture, a painting of all these great people who advanced the cause of neurology at that time. So nobody has answered anything, and no answers on the theme. Okay, so no negatives, no positive, we stay where we are. So points also stay the same, and now I'll hand over for the second half to Dr. Shrikanth, and hopefully a lot more will be scored in this half.
Yeah. Thank you, sir. I know it was tough because Dr. MuraliMohan is an excellent quiz master and is an excellent quizzer himself. He is a semi-finalist of BBC Mastermind India show. So, you know, now you can relax, you can breathe a little bit. The questions are going to be easy, simple. See, the purpose, the quiz questions are generally not like your MCQ questions or like what we ask in the examination. They are very general, like to test your overall knowledge of medicine, general knowledge, and other things. So the questions are based on that format. So we move on to round 4 with, I think this is a reversal round. Now we start from team E. So the first question goes to team E. There is something common between these two. The images I've already well known. What is common between these two?
Sir, Carter-Jenner syndrome.
Huh?
Carter-Jenner syndrome.
No. Next.
Meek syndrome.
I'm not asking syndrome. There is something common between these two. What is that? When you, on both the conditions, there is some, you use something. Next. It's already written that you need not worry about the images. The images are already labeled. Okay. Next. Next. Team A. You're trying still? No.
Tubercular pericardial effusion.
Oh. Now I'll give you this is congestive cardiac failure, that is ovarian tumor.
Oh.
Now you can raise the hand, whoever got a clue. Yeah.
Sir, ovarian hyperstimulation syndrome.
No, sorry. The correct and audience. Huh?
It's not a bad guess.
Yes. What did you say? Ovarian?
Not the right answer, but
Oh.
good guess.
Yeah. Anybody from the audience? The common link is CA125. CA125 is a marker for ovarian carcinoma. CA125 is considered as a novel biomarker in acute heart failure beyond NT-proBNP. So that is the link between these two, ovarian tumor and. So nobody gets any point. I think we start from team D. The second question goes to team D. What is common between these two? One is a peripheral smear showing a lot of RBCs, and another one is also a peripheral smear showing some RBCs. There is something common in something. There are two different conditions, but there is something common between these two.
Sir, one is a sickle cell
Yes,
anemia.
that one
the
is-
other one is looks like Plasmodium malariae, and there is.
Look at the RBCs. Okay. And what is common between these two? Next.
Target cells.
Huh?
Target cells.
No, don't guess any syndrome. Look at the commonality between these two. Next.
Hemoglobinopathies.
One is a hemoglobinopathy, that is sickle cell anemia. What is the other one? Other one shows lot of RBCs. And there is common between these two.
Thalassemia.
No.
Hemolytic anemia.
Team A. No.
Sir, polycythemia.
Polycythemia is one. Other one is sickle cell
Sickle
anemia.
cell.
What is common between these two?
Sir, sickling crisis.
No, common between sickle cell anemia and polycythemia. Anybody can guess? Yes.
Ineffective erythropoiesis, sir.
No. Yes.
Thrombosis can happen in both these situations.
Sorry?
Thrombosis can happen in both these situations.
Sir,
Okay.
stroke.
No, you already tried. I think I'll give you half point. The answer I expected was the commonality between these two is in both the condition, hydroxyurea is a treatment. Hydroxyurea is used in polycythemia. It's also used in sickle cell anemia, though the mechanism is different. In polycythemia, we use to decrease the PCV, and in sickle cell anemia, we use it to increase the HbF levels. Both decreases thrombosis and veno-occlusion in both the condition. The commonality is hydroxyurea is a treatment in both. There are two entirely different conditions, but the treatment is common. One is anemia, another one is polycythemia. So that was the intended answer. I think you answered. Both carry 5 points. Yeah. Stroke is common. Vaso-occlusive disease is common in both. So Team D from KMC Mangalore get 5 points. So the third question goes to Team C. What is common in the treatment between these two? Medical treatment.
Attended the conference, you heard it many times.
Tirzepatide, sir.
Correct answer. Explain.
Sir, it is GLP-1 and GIP.
Okay. I'll give you points, 10 points for that. The common answer is tirzepatide is approved in the treatment of obesity with diabetes, and it's also approved treatment for obstructive sleep apnea. The other one you see is an obstructive sleep apnea patient on BiPAP machine. So Team C gets, Team C from KMC Hubli gets 10 points. And the next question goes to Team 4 from BMC Bangalore. What is common between these two?
Treatment, we give beta blockers.
Sorry?
Beta blockers are used as treatment for both the conditions.
What are the conditions?
The first one is varices.
Yes.
Second one is some headache, maybe migraine.
Yes, 10 points for Team B from BMC Bangalore. The treatment is propranolol for both the condition, for esophageal varices as well as migraine. For prevention, both are used in the prevention or prophylaxis. So the last question goes to Team A. What is common between these two? The condition is already mentioned, but there is something common. Yes, then you take the mic and answer.
Acetozolamide is used in the
Yes.
treatment of both.
Dimox is the answer. 10 points for Rims Raicho. So this is an audience question. So we completed round 4. What is common between these two? Cirrhosis of liver and polyarteritis nodosa. PGs. Yes. Correct. 10 points. Sorry, we forgot to bring the chocolates. That was... Okay, we move on to the next round.
Audience has answered 3, so audience is at 30.
Yeah. So they have answered. So the next question goes to Team E, the first question. So before that, can we have the scores? Yeah.
At the end of the fourth round, Team A scores 10, Team B scores 40, Team C scores 20, and D team scores 15, and E team scores 5.
Okay. We quickly move on to the next round. An 18-year-old girl with episodes of palpitation and fast heartbeat. What is the ECG diagnosis? ECG not done during an episode of palpitation. This is a ECG. Team E. Yes. Time.
Sir, complete.
LGL syndrome.
Sinus.
GL. Langenau-Levin.
Loud.
Langenau-Levin syndrome.
Yes, 10 points. Explain the ECG findings. Short PR interval, normal QRS complex, and normal axis, no delta waves. So, you get 10 points. And the next question goes to Team D, Mangalore. A 70-year-old gentleman with dizziness, interpret the ECG. What advice you give?
The patient is having multiple VPCs and dizziness. There might be hypotension, so we might advise for a pacemaker.
Team, what condition he has?
Sir.
No negative marking. No negative marking. Team C.
Sir, multiple VPCs, I will advise Holter monitoring.
Team B.
Bifascicular block involving left anterior fascicular block and RBBB.
One more.
With
Having episodes of dizziness.
with conduction deficit.
What type?
Movitz type Movitz 2.
Type 2. It's correct. It's second degree AV block, Movitz type 2, bifascicular block, sinus rhythm, normal and constant PR interval. In between there are few conducted beats, occasional non-conducted beats, left axis deviation. So you significant problem. For a significant problem, he described a variant of disease for which he found treatment. He only found the treatment for that disease, and he described a variant of disease. He was nominated for the Nobel Prize. Any clue? This is the second clue. If you can't answer, now question moves to, this, right. No? You have to identify the person. I have given the clue. And I'll also explain why I have chosen this. Team C. At least if you find the disease, if you can mention, then I'll give you half marks. You have tried?
Multiple myeloma.
Team.
Reed's turn.
Next.
Sir, leishmaniasis.
Leishmaniasis. The person.
Donovan.
No. The person whom I have put. Team B. No. Audience. No. The answer is Dr. Upendranath Brahmachari. He discovered urea stibamine for Kala Azar. He described dermal leishmaniasis. And today in this month's JAPI, there is an article on Dr. Upendranath Brahmachari, a complete profile of his life and his achievements. So he was nominated for the Nobel Prize, probably the first one to be nominated. Ronald Ross had won the Nobel Prize, but he was born in Indian, but not an Indian citizen. He migrated to USA, okay? But he didn't get. So leishmania, you got that thing correct. That is Kala Azar, leishmaniasis. That was, the name Leishman comes from the person who identified it. That is Colonel Leishman, William Leishman and Charles Donovan. That is why it is called Leishmania donovani. So both were Indians. I mean, they worked in India, but British army officers. So I'll give you 5 marks. And the next question goes to, I think, Team B. This is a 4th question. Identify these 4 logos. You should mention all the 4 to get full marks. If you 2.5 each for one. In that order. The first one.
The first logo is Nimans.
Nimans, correct.
Third is WHO.
Third is WHO. Correct. 2 and 4 are remaining. Pass.
Second
Time.
one is Jandan.
Huh?
Second one is
Janaushadhi.
Janaushadhi, correct. Fourth one is remaining. I think your time is up. So 7.5 for them. They have identified 3 correctly. The last one is remaining, D. Next. 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 Audience, last one image. Cochrane is the correct answer. Dr. Govind Babu gets 2.5 points. Cochrane, yes. So, the first one is Niman's, logo of Niman. Second one is Pradhan Mantri Jan Aushadhi Yojana. Third one is WHO. Fourth one is Cochrane collaboration. And the last question is to, I think they answered and you get otherwise.
Just to link that to Cochrane collaboration, the symbol is actually a forest plot.
Forest plot.
I was asking
Yeah.
yesterday.
Okay. Your question. Identify the microscopic picture. It's a diagnostic test. What you see in this microscopy. Apologize. Take the mic and answer, because even the audience have to listen to what you are answered. Not only the quiz master. Answer confidently. Take the mic and answer. You are,
Sickle cell anemia.
yes, sickling test, sickle cell anemia. This is, we completed round 5, sickling test for sickle cell disease. They get 10 points. And this is an audience round question. The words Savidya ya Swasthya Sampade are seen in which logo? PG's. Somebody gave the clue already. Savidya ya Swasthya Sampade is seen in which logo? Please raise the hand. Yes. KMCRI. We have been roaming around in this campus for last 3 days. Okay. So that completes the 5th round. So now we move on to the rapid fire round. We start with any team, it's okay, like the first team. Okay, there are 5 teams. It is 60 seconds. At the end of 60 seconds, please press the time. Okay. Please maintain the time. 60 seconds, give a buzzer. So there are 8 questions. So try to get as many questions as possible. If you know, you answer, otherwise you pass, so that you get the next question. So if within 60 seconds, maximum of 8 questions will be asked.
Sorry.
For correct answer, you get 10 points. For wrong answer, you get minus 5 points. Okay, and 0 for skipping. Timer ready? Ready?
Yes, sir.
Okay. The first question, what is the antidote for methanol and ethylene glycol poisoning?
Formapizole.
Correct. What causes both emphysema and cirrhosis of liver?
Alpha-1 antitrypsin.
Correct. Which Olympic gold medalist swimmer had type 1 diabetes?
Pass.
Which Bollywood movie was based on the topic of dyslexia? Please don't give the clues.
Pass.
Which deficiency turns the tongue red, the skin dry, and the behavior irrational?
Pass.
Which drug was studied in the Jupiter trial?
Sir, pass.
A hot cross bun sign on MRI is seen in which condition?
MSA.
Correct. What is the drug for treating torsade de pointes in the
Magnesium
hemodynamically
sulfate.
stable patient?
Magnesium sulfate.
Correct. But the time was, okay. What should I put? Okay. They got, Formapizole is the correct answer. Even alcohol is also, ethyl alcohol also is the correct answer. Alpha-1 antitrypsin deficiency. Harry Hall Jr., who won 5 gold medals in 3 Olympics. Tare Zameen Par. Okay. Niacin deficiency, red tongue, dry skin, and cranky behavior. Rosuvastatin was studied in Jupiter trial. Multisystem atrophy, you got it right. IV magnesium sulfate, you got it right. So team 2, ready? Score? 10 points per. 10 points for one, I think. For each. They didn't get any wrong. 40. No wrong answers. They passed 3, and they passed 4, and they answered 4. You get 40 points. So team 2, ready? Score? Time? Okay. Which drug is used in a case in leukemia and gastrointestinal stroma tumor? both GIST tumor and leukemia, and a type of leukemia.
Imatinib.
Correct. What causes bronze skin and diabetes?
Brittle diabetes.
Wrong. Which Indian cricketer had a mediastinal germ cell tumor and made a comeback?
Yuvraj Singh.
Correct. Which Hindi movie features a character with Tourette syndrome?
Hitchki.
Correct. A J wave on an ECG is seen in which condition?
Hypothermia.
Correct. Which drug trial in COVID-19 showed the benefits of dexamethasone?
Pass.
Collar sign in radiology is described in which condition?
Pass.
What is the antidote for a beta blocker overdosage with bradycardia and hypotension?
Glucagon.
Glucagon. Time is up. Okay, I'll give you that. So, glucagon. The correct answer.
Plus 5 minus 1.
5 right, 1 wrong, 1 pass. Right? The correct answer is imatinib. You got it right. Hemochromatosis, the bronze skin and diabetes. Yuvraj Singh, you got it right. Hitchki, you got it right. Hypothermia, right. Recovery trial, which showed dexamethasone benefit. Rupture of the diaphragm. Glucagon is the correct answer for beta blocker overdosage. So,
Plus 5
minus 5, 4 correct.
4 correct. No,
5 correct and 1 wrong.
So
50, 45. 45. They get 45 points. Good show. So team 3. Timer. Yeah. What is the drug of choice for falciparum malaria in first trimester of pregnancy?
Hydroxychloroquine. Chloroquine. Hydroxychloroquine. It's a
Wrong.
chloroquine.
Lemon on stick matchstick describes which condition?
Pass, sir.
What is the common cause of a crew-cut appearance on skull X-ray?
Thalassemia.
Correct. Who is the author of the book, The Song of the Cell, An Exploration of Medicine?
Pass.
Which drug was tested in the Paradigm HF trial?
Arnis, sir. ARNA. Angiotensin receptor.
Correct. Epsilon waves in ECG are seen in which condition?
Pass, sir.
Which vitamin compound is the first line of treatment for cyanide toxicity? Okay. Your time is up. There is one more question remaining. Okay. This is okay. This question is just. So you got artemether lumefantrine after post 2022 is a treatment of choice. Before that, quinine and clindamycin was the treatment for first trimester pregnancy. Cushing syndrome, lemon on matchstick appearance. Thalassemia major, you got it right. Dr. Siddhartha Mukherjee, you didn't answer. Sacubitril valsartan, you said ARNI, 10 points for that. Arrhythmogenic RV dysplasia, epsilon waves. Hydroxycobalamin is a treatment vitamin which is used in cyanide poisoning. Alexander Zerov had type 1 diabetes. So you got 2 right and 1 wrong. So 15 points total. So team 4, it's your turn now. Timer. Pencil in the cup deformity is typically seen in which condition?
Psoriatic arthritis.
Sorry?
Psoriatic arthritis.
Correct. Which is the only non-statin lipid-lowering drug shown to reduce cardiovascular mortality?
Pass.
Who is the author of the book Covenant of Water?
Pass.
Who was the first physician to become the chief minister of an Indian state? Correct. A fish hook sign in the precordial lead is seen in which condition?
The digoxin effect.
Okay, next. Which drug can be used in the refractory anaphylaxis not responding to adrenaline?
Pass.
What is the most common paraneoplastic syndrome in small cell lung cancer?
Cushing syndrome.
Sorry?
Cushing.
Wrong. Which antibodies are present in the heparin-induced thrombocytopenia?
Against platelet factor 4.
Correct. So
Second one.
second one.
Can we answer?
No, time is up. Okay, there is some confusion about fish hook sign, I think. The correct answer, psoriatic arthritis, is right. The second is ezetimibe and bempedoic acid. Dr. Abraham Varghese, BC Roy, you got it right. Benign early repolarization, Fish-Hook sign. You said digoxin, okay. Benign IV glucagon is a treatment for SIADH is the most common manifestation in small cell lung. Anti-PF4 antibodies, you got it right. So 1, 2, 3 correct, 2 wrongs, 30, 20 points. So the last question, last round, ready? Which electrolyte abnormality can cause torsade de pointis in a structurally normal heart?
Hypokalemia.
Wrong. Which drug improves survival in heart failure with preserved ejection fraction?
SGLT inhibitors.
Correct. Which ECG abnormality is characteristic of hypocalcemia?
Prolongation of QT.
Correct. Which physician memoir, When Breath Becomes Air, became
Pass.
a bestseller after his death from lung cancer?
Pass.
Which condition has a fried egg appearance on bone marrow biopsy or lymph node biopsy?
Pass.
Which was the first women-only medical college in India?
Pass.
Which organ is spared in polyarteritis nodosa?
Lungs.
Correct. Water bottle heart on X-ray is seen in which condition?
Check it.
The time is up. Hypomagnesemia. That is the correct answer. You said hypokalemia. SGLT2 inhibitors is correct. Prolonged cure interval is correct. Paul Kalanithi, when breath becomes air. Hairy cell leukemia. Right. Lady Hardinge Medical College in New Delhi, 1916. Lungs are spared. Pericardial effusion, the last one. Okay, you got 1, 2, 3 rights and 1 wrong. 25. So with this we come to the end of this round and as a quiz program. While we calculate and announce the result, the final score, do we need a tiebreaker round? I don't think so. Audience. So, for those who participated and for those who participated in the preliminary round, take this message, take pride in how far you have come and have faith in how far you can go. So with this message, we conclude this quiz program, thanking the API-KC Chairman, Secretary, the Scientific Committee of Kapicon, Dr. Vishwanath Krishnamurthy and Dr. Vishwanath from KIMS who helped us, volunteers, and both PGs and UGs who helped us in this quiz program, and all the participants and audience. Thank you. Before we... The third prize goes to the team from KMC Hubli. Ramesh and Yatish. Yes, with 55 points. And the second prize goes to Dr. Tarun and Dr. Jeet from KMC Mangalore. And the first prize goes to Dr. Akshay and Dr. Aditya from BMC Bangalore. Congratulations. All of you have done very well. Congratulations on behalf of the quiz team.
Yeah, congratulations to all of you. You all have done a brilliant job. The questions were very difficult, I accept, but then I have a very high opinion of all of you, which is why I set such a tough quiz. It's boring to get every question answered also. Some have to be passed on. Okay, so excellent results. Thanks, of course, to Dr. B.K. Sundar for sponsoring this year after year. Sundar, are you here? No, he's not here. Okay. So, and to the API for giving us this opportunity to conduct the quiz. Very special thanks to Dr. Shrikanth, who's done an outstanding job.
Oh, thank you, sir.
And
yeah.
And BMC, you all upheld the title for...
I immensely thank Dr. MuraliMohan and Dr. Shrikanth Hegde and all the people who helped for the quiz.